Okay, last section deals with joints, and we're actually skipping through part of this. So I am going to go directly to synovial joints. Most joints of the skeleton are synovial joints. Anyone who's had knee problems, shoulder problems, these are all synovial joints. They allow more free movement, more free range, which is more complex than fibrous joints are your sutures in your skull, and we are not going to talk about those. And cartilaginous joints would be like the vertebral discs in between your vertebrae. So a synovial joint is going to be involved with the ends, the articular ends of two different bones. So we'll mostly look at the knee because that's a very common joint that causes problems. Each of the bones in a synovial joint are covered with hyaline cartilage at the ends or at the head of the bone. A joint capsule consists of an outer layer of dense connective tissue that's going to join the bones that are involved. It's going to join at the periosteum, and then an inner layer is going to be the synovial membrane. So there's an outside protective part, the joint capsule, and then an inner synovial membrane. The synovial membrane itself secretes synovial fluid, and that fluid is what will help to provide lubrication, give it movement so that bones are not grinding on each other. The consistency of that synovial fluid is somewhat like egg whites. So it's not like water, it's a little bit thicker than water, but it is a fluid and it does help with lubrication and free movement. Very simple picture. If I'm looking at the ends of two different bones, each bone is going to be covered with articular cartilage at the end. All long bones are going to have that articular cartilage. The outside part is the fibrous capsule, and then the membrane that is inside will be the synovial membrane. And inside that synovial membrane then is where you're going to find the synovial fluid that helps to keep the joint freely moving. Give me a couple minutes, Marcy. Some synovial joints contain meniscus or menisci. So when they talk about tearing a meniscus, that's actually basically a pad of cartilage that's going to be found. The main one that I'm thinking of, the meniscus in your knee, sits on top of your tibia. And that pad then is a shock absorber, and it also helps prevent rubbing together of the bones. Some synovial joints, I'll be done in a minute. Some synovial joints have fluid-filled sacs called bursa. So if someone has bursitis, usually it's an inflammation of those bursa packets that have or containing the synovial fluid. And those bursa are going to help kind of cushion tendons as they slide and move over the bone. So here's the main diagram. So this would be the femur, and this would be the tibia. Here I'm going to find that articular cartilage, and then there's actually a meniscus pad that would fit in there. The bursas are scattered throughout. I don't expect you to memorize the names of the bursa, but they're just little packets of fluid where there may be a tendon. There's going to be tendons that reach from your patella to muscles that are found down here. So they help protect the bones with the fluid in front of it. Notice a large portion of here is full of synovial fluid, and also like your ACL, your MCL are going to help to hold your knee joint together. Types of synovial joints: ball and socket, condylar, plane joints, hinge, pivot, saddle joint, your thumb. I will not ask specific questions about that. The only other things I want to look at are your types of movement. So abduction means to move away from the midline. Add, you're adding it to your body. So adduction, bringing to the midline of the body. Abduction means away. Flexion, any type of flexion is going to decrease the angle. So when I flex my arm, the angle decreases. Extension is going to straighten that angle out. So flex, decrease, extend, increase the angle. And you can look at the definitions, but I think the pictures show them better, so I'll describe the pictures. Dorsiflexion and plantar flexion deal specifically with your feet. So dorsiflexion would be to lift your toe upward, pull it towards your shin, and plantar flexion would to bring your toe down and point your toes. Circumduction deals with circle-like motions. Typically that's going to occur at a ball and socket joint where you can make large movements. Medial rotation deals here again usually with a ball and socket. Medial is going to bring towards the midline. Lateral is going to bring away from the midline. And then two terms that deal with movement of the hands. Supination, I memorized this in college as supination because it reminded me that palms up. So supination means that your hands are upward. Pronate or pronation means that you're going to bring the palm down. So those are two other movements. And then ones that are very specific that we don't use very much. Inversion with your feet is to bring inward. That one should be easy to remember. Eversion is to bring it out or away from the midline. Protraction means to protract or go forward. Retract would be to bring backwards. And then shoulders, I can elevate, I can depress. Elevate means basically to lift upward, and depress means to bring downward. So those would be movements that we have, and that is the end of our skeletal chapter. So good luck, study hard, and good luck on the test.